Rahman Rahim, and good evening to all of you viewers. Today we will discuss about the second part of the what is nursing profession. In this session, we will discuss about the safe nursing care. As we have started this session, that in this um, component section, we will discuss about the basic and core concept about the nursing profession, like what is nursing profession, what is the difference between occupation and nursing discipline. That is what we have already discussed. In today's session, we will continue with the same topic and we will discuss about the safe nursing care. So these are the basic concept which every professional must have the basic knowledge about their basic essence and core concept. So this is the continuation of that section, like what is nursing profession. Now, in order to define the safe nursing care. Safe nursing care is the most recent IOM report. They have described, identified the component of the quality care for the 21st centuries that is centered mostly on the conceptual component of the quality rather than the measured indicator. And we will discuss about that. What does it mean? Like here, the safe nursing care mean like the quality care is safe, effective, patient-centered, timely, efficient, and equitable. So we will discuss this definition as soon as we progressed during the sessions. So here the main focus is that quality is defined what it measure rather than measured by the indicator. That indicator we will discuss. Like as I have mentioned below in the slide, like the 5Ds are the quality indicator. Usually the healthcare professional measure like the mortality rate, the death, disease, disability, discomfort, and dissatisfaction of the client are the quality indicators that is measured by the auditor that how the hospital or the facilities provide a care to their clients. So these basically reflect the quality. But here the concept of the safe nursing care is mainly focus on the quality component of the care rather than the major indicator that we have discussed. Like as they have mentioned that the quality is safe, effective, patient-centered, timely, efficient, and equitable. So as soon as we progress to the session, we will understand this concept. Like it means that as the Loher mentioned in 1988, that the safety is the foundation upon which all other aspects of the quality care is mentioned. So quality is defined by Hartilov, as he mentioned that quality is an optimal balance between possibility realized and a framework of norms and values. This is what the quality mean. And it can be measured by certain indicators like what we assess during our unit or ward audit, like what is the mortality of the unit, the disease, morbidity rate, disability, discomfort, and satisfaction, client satisfaction. So all these are the quality indicator. Now, with respect to the quality, what is the quality health and why we are measuring this quality? So the quality, as we have defined, and why we are studying the quality uh, uh, in the nursing subject, in the nursing profession, and why it is necessary, because to provide a quality health care, to ensure the quality health. So the work of the American Academy of Nursing expert panel on quality health focused on the following positive indicator of high quality care that are sensitive to nursing input. Like they have mentioned, and they find out that the quality care mean, the quality health mean like achievement of the appropriate self-care of the patient himself, demonstration of the healthcare behavior by the client, related health related quality of life, like their medicine compliance, their knowledge about their therapy, their perception about their health are all these the quality indicator which we as a healthcare professional must mm, expect from their client so that they should know. So the perception of being well cared, like this are the feedback will be given by the client that they have been well cared, and the symptom management for the patient came with the symptom and now how he feels. So these are basically the basic concept that given by the American Academy of Nursing expert panel, that the quality health is composed of these components. Then we consider that the facilities of the hospital are providing the quality care. Whereas the another aspect of the quality, as I have mentioned, are the indicator. Like as we measure in the unit are the hospital audits. So we measure the mortality rate, the morbidity rate, like disease, the adverse event, any needle stick injuries, like these are the indicators that tell us the history of falls. These tell us that how quality care are provided by this facility. So these are basically the negative outcome of interest that represent the quality of that organization and our facilities. And interest that represents the integration of multiple care provider input. Multiple care provider input, like we measure these quality indicator as a whole in which the whole team is involved, like the doctor, nurses, technician, every professional or person involved in that unit. So basically all these team are responsible for these negative indicator. Whereas the concept of quality health with respect to the quality rather than the major indicator is basically focused on the nursing aspect, like the quality care is safe, effective, patient center, timely, efficient, and equipped. So now the trend has changed from the quantity or from the indicator to the quality focus. That is basically the job of the nursing profession. So I'm trying to clarify all these abstract concepts more simply. And this is what the literature have identified, that what the quality health mean, what is quality and what is safe nursing care. So in order to elaborate and summarize these two slides, what is mean by the safe nursing care? So basically the IOM is a organization. They have given they consistently the reports about the health structure or the health system. So I will explain also about the IOM, that who are the IOM are. So they have mentioned that they identified the component of the quality care for the 21st centuries as center on the conceptual component of the quality rather than the measured indicator, as I mentioned the below 5Ds. So that conceptual indicator of quality is basically the quality care is safe, effective, patient-centered, timely, efficient, and equitable. So this is what uh, we will discuss about in this session, like what is safe nursing care. Before moving ahead, I request all the viewers to subscribe, like, and share the theoretical nursing to learn from more advanced concepts. Your feedback and the consistent viewership encourage us to read, prepare, and bring more advanced concepts to this channel. So we request you to kindly subscribe. Now the Institute of Medicine IOM reports. These are basically one of the experts, the scholars groups that made reports on different and reading multiple scholars research, and they identified what are the system problems. So they have identified that the patient safety is one of the aspect in which has moved from the forefront of the healthcare as a result of the Institute of Medicine report. After publishing of the Institute of Medicine report, and that report was titled like to err is human, building a safer healthcare system. So that report was published in 2000. In this report, they have mentioned that what is mean by patient safety, and this patient safety um, concept was brought after reviewing studies of different adverse event and patient deaths in different facilities, different area of the world, and hospital across the countries. And the report found that approximately half of the patients were due to the medical error and could have been prevented. So after getting and finding out these finding from different research and different perspective of people, school of thoughts of people, they have mentioned that all these adverse event and patient death, what we call it the patient indicator, is mainly caused by the mm, medical error. The medical error, rather than and that could have been prevented. So this report have brought a great change in the patient uh, health or the in the health structure, in which the completely the paradigm shift occur in the patient, the organization, and the health structure. Uh, Thinking was focused uh, mainly on the quality care that is called safe nursing care. So in studying the cause for these error, when they have when the IOM report studies that why these adverse events and patient death occur. So after reviewing the cause of these error, they have identified that the current healthcare system is complex and error prone. So the medical error was blamed that these medical error is uh, are caused often need due to the complex health system rather than blaming the individual. So error are not caused by the bad healthcare worker, but are due to the bad system. So they have blamed for all these adverse event uh, the healthcare system rather than blaming the individual or the healthcare professional. So the shift was changing, and now the focus was given on to improve the system rather than blaming the staff and punishing them. So now the focus has changed from the um, individual or from the professional to the system. And after publishing this report, they have given some recommendation like for improving the healthcare system and processes to improve patient safety in a healthcare organization is one of the important aspect. If we prevent or ensure patient safety, so we could improve the health. um, we can provide the quality care and safe nursing care. So patient safety is one of the aspects that have mentioned in the IOM report. IOM means the Institute of Medicine report that was first published in 2000 and which have brought um, major change in this health system. According to another report, as published by the IOM again in 2003. They have published that another companion report like To Err is Human, and another title was changed like Keeping the Patient Safe. So in that context, mainly the focus was given on the work environment for the nurses. Now the focus is again changed to the um, the healthcare professional. Like the system was improved, now the focus is given like the transforming the work environment for nurses. Nurses have to give a conducive environment to work safely and to ensure to implement their intervention uh, uh, safely according to your discipline knowledge or their discipline responsibilities. So recognizing nursing is the largest segment of the healthcare workforce, and they have given recommendation that in order to improve provide the quality care and safe nursing care. The role of the nursing is very much important. Uh, and beside that, it is part of the responsibility of the healthcare organization to provide a conducive working environment for the nursing. So the focus was mainly on the nursing professional. In the report called for a change in nursing staffing level, like staffing level, the number of staffing level was increased and limit nursing work hour. They mainly focus on the work time, uh, till how long the nurses professional can work effectively and productively. In addition to these changes, the nurse workspace, work processes, and organization culture was important aspect of this second report, and which was titled "To Err is Human, Keeping Patients Safe." So, in order to ensure patient safety, it is necessary for the any facilities organization to make sure that there were competent nurses, conducive environment, and enough nurses, uh, uh, proper working schedule, uh, and the importance of the nursing discipline, nursing profession, and the healthcare system. And they consider that nurses are the backbone of the healthcare system. In order to proceed, the patient safety concept was also given by another organization, that is one of the auditor of the healthcare system, that is called the Joint Commission on Accreditation of Healthcare Organization, usually called it JCIA. Usually, this organization registered the healthcare facilities and audit them for provision of quality care. So, in their report, they have also mentioned that the patient safety is also committed to improving safety for patient and healthcare organizations. So, it is also one of their aim to improve the patient safety. And their main focus and standard work was focused on patient safety. And their GCIA report in 2001, GCIA introduced the standard that required organization to determine the cause of an event. If there is any adverse event happened, so there must be a system like the root cause analysis system to analyze those adverse events. So they have brought another concept like the root cause analysis system. So the focus here was to avoid the adverse event, to give a quality care. Now, how to avoid those adverse events? The GCIA reported that the root cause analysis system should be implemented retrospectively, back dates, like what were the reason how these adverse event happened, and how could we have prevented. Besides that, they have also established the standard to analyze high risk processes like using a failure mode and effect analysis procedure. This is another guideline in which uh, they are basically analyzing the high risk process like history of fall, risk of bed sores, and similarly this type of um, failure in which can happen normally can be analyzed and how could it be improved. So these two concepts were given by the GCIE that were mainly focused on the main topic of patient safety. In addition to that, in 2002, GCIE introduced the National Patient Safety Goal in America. And the goal focused on the patient identification, verbal order, dangerous prevention, surgical site marking, and time out for patient, procedure, and site verification, infusion pump, and clinical alarms. So now the quality, the focus is given on the quality care. So you see the trend of the care is changing. Like as we have mentioned that the topic is safe nursing care. So the IOM given the report of the to erase human, and then the system were improved, and in another report they have given the importance of the nursing profession, and now The GCIE have, are mainly focusing on the quality care, how these adverse events could be prevented. In another edition, in 2004, the GCI established a goal related to hand washing and hospital-acquired infection. This was another edition and their report that nurses can play a key role in building and modifying patient care practices to achieve the patient safety. So these were the basically the core concept how a patient care, safe care can be given in order to ensure the patient safety. So these were the broader concept of the patient safety in which we as a nurse care, healthcare professional can ensure the patient safety by having a root cause analysis and a failure mode and effect analysis procedure. These are the tools then which we can analyze the different adverse events, medical adverse events, and the high risk patient like the bed sores and the history of all risk patient can be analyzed. So patient safety was one of the main concept of the safe nursing care. Another concept, the focus was given on different researches like the personal safety. Like we as a nurse are working with patients 724 hours when we are lifting, shifting these patients. We are at risk of chemical hazard, radiation hazards. We can get infection. We can different procedure. We can get a needle prick ender. So now the personal safety protection concept was brought under discussion by different scholars, and nurses, as I have mentioned, may be at risk of personal harm. Personal harm mean can get injury in the workplace where the nurse working in the unit. The American Nursing Association has sponsored initiative, and that initiative main aim was to improve nursing personal safety. Now, how the Center of Disease Control and Prevention estimate and why these personal safety was uh, brought under consultation because the CDC report estimate that uh, 384,325 healthcare workers are injured by needles, pricks, and other sharps each year. So these are the number of healthcare professionals, especially nurses, that can get needle stick injuries and other injuries while working with patients. So is it important to avoid these injuries and get healthcare professionals, especially nurses, safe. So nurses sustain the largest percentage of these injuries, as the American Nurse Association mentioned, like the safe needle, safe lives concept or cry was brought, and this campaign was a key in promoting the use of the safety devices, like the needle prick injuries were avoided by after um, bringing this concept like this safe needle and safe life. So if we are safe, we can provide a better care and quality care or either safe nursing care to our patient. Now the Needle Stick Safety and Prevention Act. This was another edition. How could we prevent this needle stick injury? So in America and US, this act was brought. That was another addition to protect the nurses while caring the sick patient. So in this act, they have mentioned that nurses and other healthcare professionals are protected by the law. So they have given the law protection to the nurses, like require the healthcare organization to use needleless or shielded needle devices. It was compulsory, obtain and input from the clinical staff in the evaluation and selection of devices. What the facilities uh, sell or buy any devices, they should take input from the uh, working staff. And it was also necessary for the facilities to educate their staff on the use of safety devices or any other new devices. So they must train their staff. So these were part of this needle stick safety act, and they have also mentioned the physical work environment, like in which we have mentioned that nurses are include the patient handling tasks such as manual lifting, transferring, and the positioning of the client that can place nurse at risk of back pain and musculoskeletal disorder. So this concept, the American Nursing Association ANA brought the concept or the campaign that was titled like the handle with care. The aim of this campaign was to prevent such injuries and to promote safe patient handling through the use of technology and assistive patient handling equipment. So all these patient acts were mainly focused uh, on nurses' personal safety. So these were the steps that were taken by the US government to protect nurses and to ensure their patient uh, quality care and to get a safe nursing care. So these are the important pillar or important aspect of the safe nursing care to ensure the patient safety and the personal safety. Personal safety, I mean, if I am as a nurse, I am safe, so I can provide a quality care to my patients. So patient safety and my personal safety is one of the important aspects. Another aspect of what that is called culturally sensitive group. Culturally sensitive group was why it was important in America. I'm discussing these slides, and most of the time I'm giving the example of America because in America they have brought drastic changes in the nursing discipline, and they have provide us the guideline, the world to, to guide uh, other countries, other people about the quality care. So all of these guidelines basically developed from the Western world. So the changing demographic mean like in America, most of the people trying to migrate to America, so their demographic changes. Different nationalities people visiting to United States and other countries like Western countries for livelihood and work and uh, livelihood. So the demographic of the country is changes. So now the need was felt that a nurse at a time will deal a patient from Italy, from Tanzania, from Pakistan, and from other countries from different cultures. So how American nurse should care all these clients at the same level. So these culture sensitive care concept was brought, and Leninger was the nurse whose work was mainly focused on this culture sensitive care. And I will discuss her work in detail some other time. But in the culture sensitive care, they have mentioned that nurses must provide culturally competent care by expanding their knowledge about different culture. And as a nurse, I must study the different culture. Like I must know how the Italian core culture is, and their tradition is, how the Chinese tradition is, and how the Western tradition is, how the Muslim and the Jewish tradition is. So these are basically the tradition in which have their personal beliefs and personal and social and religious beliefs, and that must be respected as per the core concept, basic concept of our nursing ethics. So many print and online sources are available to provide this information, and the course context also, course books also have some background knowledge of different cultures. So as a nurse, it is a responsibility to brief, to study about the different beliefs, various tradition of various culture, because this migration is one of the fiasco problem for Western culture. So working in the US or Western countries as a nurse, it is important for nursing professional to must be aware of different culture. Even here, we have people from different cultures, school of thought, so we must know how to care these people. And suppose I'm giving the example of the Jews. If the Jews avoid the blood transfusion, so you have to respect their culture, and you have to provide them the alternate therapy rather than forcing them to transfuse the blood. Similarly, the Muslim cannot break their fast during Ramadan, so you have to respect them. So all these are the belief. Mm, in the Sikhism, they do not cut their hair. So you have to believe their culture. So the culture sensitive care is very much important aspect of the nursing discipline. And the nurses must use avoid generalization and stereotyping of patient. We must not uh, belief on these uh, stereotyping, that what the Spanish culture is, what the Spanish people believe, and what the Patan believes, and what the Jews believe. So, as a nurse, we uh, must be neutral and a positive minded one to avoid speculation and stereotyping of the patient, because it can affect our concept of quality care or a safe care provision. So the culture sensitive care begin with individualized patient assessment, like depend upon individualized approach. Like dealing with the Italian patient, their perception about the health will be different from that of the Chinese uh, culture people, and that of the Indian culture people. So all these are individualized approach that nurse must be competent enough to assess their individual beliefs and individual handling. And similarly, it is necessary for healthcare professionals, especially nurses, to develop their individualized plan. As I have mentioned, the Leninger was one of the theorists that they have offered guideline for providing care to the patient from different culture, and her work have brought uh, through light and trans culture or culture sensitive care. So some other time we'll discuss uh, about the Leninger work on the theoretical section, nursing theory section. So in culture care negotiation, the patient and the healthcare staff negotiate the inclusion of the culture practice in the treatment. And yes, it is compulsory, because in some culture, the organ transplant is prohibited. So as a healthcare professional, we must respect their cultural values. So the culture practices, the inclusion of the culture practices in the treatment is very much compulsory. Now, for more advanced concept, kindly subscribe, like, and share my YouTube channel, Theoretical Nursing, to learn for more advanced and basic concepts. Your feedback and consistent viewership encourage us to prepare more advanced and uh, valuable content for you. Thank you very much. Thank you so much.